good morning, good afternoon. Welcome to FAScinate, organized by Academy Science Malaysia. My name is Madeline Berma. Today, I'm going to present to you about Indigenous communities and COVID-19, response and resilience. This topic is very relevant to us today, especially in these present circumstances, now that we are in the COVID-19 era. So I will focus on these three issues. One, the indigenous communities. Secondly, COVID-19. And thirdly, the responses and how the communities have responded to COVID-19 and built their resilience. Okay, welcome to this FAScinate. Now, let me introduce myself. My name is Madeline Berma. My field of specialization is development economics, and my research focus had always been on poverty and rural development. So if you notice the slide I am sharing with you, this pretty little girl, she has her mask on. So this is really befitting the discussion today or my presentation today. Is about COVID-19, which is always reflected by the use of the mask and its impact on indigenous communities. And the indigenous communities in Malaysia, as you can see here, is this little girl. She is from the Orang Asli community. Now, there are four aspects that I will focus on in this presentation, in this short presentation. First, I will discuss what we call the health economic nexus. Secondly, I will focus on what is the impact of the COVID-19 pandemic. I am from the economics, and I definitely will focus on the economic issues rather than the health issues. Thirdly, I will discuss the impact of COVID-19 on indigenous communities. So we would like to know, most of the time, we only heard about the impact on people in the urban areas, people in the, what we call, the mainstream communities, But today I am going to focus on the indigenous communities because most of the time they have always been marginalized in the discussion, in our discussion about issues, in our discussion about economics, about health. But today the focus will be on the impact of COVID-19 on indigenous communities and some of my recommendation. Okay, let me focus on the first one, health and economic context, to provide the context for our discussion. Now, this is a curve that many of us have been hearing every now and then when you listen to the minister, when you switch on your TV, you listen to the radio, they always talk about to melandaikan kelok, to flatten the curve. So what curves are we referring to here? The curve that we are referring to here, if you look at the above curve, the curve on the top is what we call the pandemic curve. If you look at the curve on the top is the pandemic curve, the red here. Now, the second one, the one that is below, is the economic curve. Now, the curve reflects here as it goes higher. What it means is that it is referring to the impact of the increase in the number of cases. So the higher the cases, without any policies by the government, it will lead to economic downturn. So we have heard what economic downturn means, economic lockdown. You've heard about MCO, where all the economic activities are being closed. Yeah. So see, these are some of the efforts that the government have done to contain the COVID-19 outbreak. Yeah? We look at all the effects on, we can't go to work. There is a restriction on our traveling, no religious activities, and most of us could not go to work. Some of us, and in fact, our children can't even go to school. The universities are closed and things like that. So these are some of the efforts to contain the pandemic, or rather to contain the virus, to prevent it from spreading. So look at what is the impact. So this is a very, very important, or rather very important, what we call slide to show that how the pandemic has affected the economy. So if you look at all the red dots here, all the red figures are signs of the pandemic. So in order to stop the pandemic, to prevent the pandemic from spreading, the government has introduced what we call the MCO, the lockdown. Malaysia had introduced 3 MCOs, and we are currently in the 3rd MCO, Movement Control Order. So all the economy has to stop and look at it. It has an impact on the household, the government, the businesses, the financial sector. So it disrupts, if you look at supply disruption, and it affects demand disruption. So what does it do? What is the impact of this lockdown and this pandemic on the indigenous communities? Number one, it poses serious and economic risk to the physical and cultural existence and traditional livelihood of indigenous people. The indigenous people rely on the forest for food, for their livelihood. Because of the pandemic, the government has instituted, or rather imposed, rules stating that no one can move out of their longhouses, or movement restriction order. So they can't go out to find food for themselves. So they have to rely on food from the government, to rely on basket of food, brought by the NGOs and also by the Yang Berhormat. But because of the MCO also, these food are also not easy to be distributed to the communities because of the movement control order. Secondly, we see the loss of livelihood. Many of them experience job losses and means of subsistence. So one example, this is by my friend Peter Kalang. He's involved, he's an Orang Ulu himself from Sarawak. So the indigenous communities, he said, need to travel to town to get coffee, to get milk powder, sugar, flour, tea. You can get these essentials from the jungle, because to them, the jungle is the supermarket. At least here in the urban areas, we do have the Grab, do have e-hailing for them to send food to us. But for these people in the jungle, for those who live like the Orang Asli, the indigenous communities of Sabah and Sarawak, the Penans, the Iban, the Orang Ulu, the Kedazan, the Dusun in the rural areas, they face they experience the loss of means of subsistence. So this is a really impact on their, what we call their food, or rather means of subsistence. And also they have limited access to food supplies and safe and clean waters. So if you notice here, during the MCO, many indigenous communities ran out of food supply and had to rely on temporary food aids due to loss of income. And also, as I mentioned just now, they cannot go to the forest to search for food. Used to be where they used to them, that is their supermarket. They used to tell me, that's our supermarket. So similarly, they can't go to the river to fish. They can't go to the forest to hunt for, wild boar, babi hutan, or to find fruits, or to hunt in the jungle. So this lack of access to adequate food results in hunger, food insecurity, and malnutrition. These are the communities who have no problem in the past when it comes to food security, because they can rely on the jungle. But now, due to the COVID, they cannot have access to the jungle due to the movement control order. Okay. So another thing that they also have limited access to relevant information. They do not know what is happening out there. They do know there is such a thing called COVID. Yeah, when I talked to the communities, they said Kubit. I was thinking they were referring to Chubit, but they were actually referring to COVID. Yeah, they call me Kubit. Okay, so to them, to the Iban, there is very limited information. And also, we realized that many of our information were mostly in the mainstream, the language spoken, official language, Bahasa Melayu, English, or in terms of Chinese, they do. But in Sarawak, we have more than 40 ethnic groups. They do not have access to relevant information, for example, in the local language, to prevent and prepare them from the rapid spread of COVID. So there's a lot of fear. There's a lot of people who are saying, that's where fake information comes in, right? Now, another thing that also is the problem is that there were drastic restrictions on the exercise of their cultural practice. During the MCO, the indigenous communities had no access to the fishing, gathering, and hunting grounds. They are deprived of their means and access of their realization of right to food. So, as I said, People like us in the urban areas or people who live near to the supermarkets, they have access to food. But to these communities who have long relied on the forest for their food supply, the COVID has really means a lot to them, because it means it is a breakdown in the sustenance. Yeah? So also there is absence of healthcare facilities and social security. These are vaccination challenges in rural Sarawak and Sabah because of distance and logistics. And also we've heard a lot about lack of remote learning opportunities for Indigenous children and youth. We've heard how, if you look at the title of our news, ada buaya tapi wifi tak ada. So cabaran pelajaran pendalaman Sarawak ketika sekolah ditutup. So these are real challenges. Okay, so that's the impact of COVID on Indigenous communities. Okay, so if you look at this, some of the photos I'm sharing with you, how food have to be transferred using helicopter. Okay, Long Lamai in Sarawak. Okay, and then we see how because of fear they install or rather they impose their lockdown. They have a double lockdown, not only the government lockdown, they also have their own lockdown because there's a lot of fear. Okay, and orang asli has to rempuh or redah lumpuh to get the bantuan prihatin, to get the few $100 that the government is providing, because they need to get the bantuan from government office or to the nearest to the nearest office, which is about maybe 3 to 4 hours drive, and sometimes look at this condition. And for example, this is a newspaper in Sarawak, in a place called Pakan. How they have to travel long distances just to visit this place, just to get the police permit, to travel to get money, to go to the bank, to go to the clinics. So these are the impacts that are really, really real. Yeah. So the last part, these are my recommendations. Number 1, to provide support. Number 2, for the new model post-COVID, there need to be inclusiveness. When designing policies need to be designed to include the communities so that no one is left behind in terms of policy design. So and in terms of post-COVID recovery, we need to establish post-COVID-19 recovery that support Indigenous people, traditional livelihood, and take the issues into our recommendations. And finally, we need to have this what we call FPIC, to obtain the free, prior, and informed consent of Indigenous communities, so that we know the COVID-19 has really impacted the livelihood, and the sustainability of the Indigenous communities of Malaysia, the orang asli, the Penans of Sabah and Sarawak, the Kedazan Dusun. So with that, I thank you, and I look forward to you participating in our future FAScinate program. Thank you very much.